back. Hi, my name is Liz Enderly. I'm going to be your nurse practitioner student today. Can you tell me your name and date of birth?
Jocelyn Leonard, 12/5/1982.
Perfect, thank you. Sorry about that. Just wash my hands here first. So before I would step in the room, I would make sure to note vital signs, making sure that blood pressure, pulse, temperature, respirations are all within the normal limits. All of your vital signs are within normal limits today. We're not worried about those. Can you tell me what you know about nurse practitioners?
That they are my provider today.
Yeah, so nurse practitioners are similar to PAs and doctors. They can both diagnose and treat illnesses. So what we're going to do today is an assessment. First, we're going to start with skin. I would also note the patient's general appearance. She appears calm and cooperative, ready to provide her own history and exam. So first with skin, we would assess color. I'm going to be looking for any erythema, redness, cyanosis, pallor, which can indicate low hemoglobin, and jaundice as well. Looking for any lesions, scaliness, plaques, dry skin, eczema, that sort of stuff. We're going to assess fingernails, toenails. We're going to assess all of the skin. We're going to look at her scalp, both front and back sides. After assessing skin color, we'll assess the skin moisture, checking if she feels clammy or diaphoretic. And we can also assess skin turgor. We'll palpate hair and take a look at the scalp. And then throughout the whole exam, I would make sure to maintain adequate draping and coverage. So first what we're going to do is I'm just going to generally assess your color. For this, I would start at your head. I'm looking again. A lot of the mucous membranes are good places to look for any sort of pallor, jaundice, cyanosis, so looking especially at lips and fingernails and toenails. So I would start looking around at her face, looking for any lesions, discoloration, kind of like we talked about. Make sure to look at her neck. Next, if the patient was wearing a gown, I would assess chest. We could do one arm and then the other arm. While the patient's still sitting, I could go ahead and assess her back, looking again still for discolorations, any hypo or hyperpigmentation. You can go ahead and look at your scalp and hair, noting hair texture, quantity. We can look at the scalp for any lesions, patchiness, any nits. Making sure to look all throughout. So patient's hair is thick, there's no pattern of loss. I didn't see any sort of dandruff or nits or anything like that. Next, I can assess legs, front of legs. Definitely looking at toes, and then go ahead and stand up. I can assess the back of the patient's legs. Sure, if you want to turn either way. Perfect. So I would assess the back of the legs, still looking for any of the discoloration and lesions. So what I'll do next is I'll assess your nail beds. I'm looking for shape, I'm looking at color, and we want to make sure there's no clubbing of the nails, discoloration, cyanosis again. We can check capillary refill. Good. And then I would assess toenails, the same thing. I would palpate and inspect, also looking for any types of lesions like a fungus or any other sort of abnormality. Coming after inspection, we're going to assess temperature. So I would use the backs of my hands, and I would assess the upper extremities. I'd assess the fingers again, making sure that the fingers are not a different temperature than the rest of the upper extremities. I would then assess lower extremities, both anteriorly and posteriorly for temperature, and last but not least, toes. So everything feels warm. Next, I would palpate for any sort of moisture, so if the patient feels clammy. For this, we use our fingertips. Good. Again, not feeling any clamminess, patient isn't diaphoretic. If I did notice a lesion during the exam, I would describe the shape, the color. I would identify the type of lesion, so a macula, a papule, that sort of thing. I would note its texture, distribution, if there's any drainage. And then also when we're assessing skin, if we find a nevus, a mole, we would use the ABCDE, which is asymmetry, border, color, diameter, and evolution. So if there's any changes in the shape, if it's abnormally large, if the borders are irregular, color is different throughout, or asymmetric, then we would further assess that. Looking we can look into the mouth to look for any sort of discoloration, pallor, jaundice, looking at those mucous membranes, cyanosis, that sort of thing. And then skin turgor, so we can assess if the patient is dehydrated. We take a little pinch on the back of the hand, and the skin goes right back to its original place, so I know that Jocelyn is not very dehydrated, she seems well hydrated. And that's the skin exam. All right, next we're gonna move on to head and neck assessment. So with the head inspection, I'll be looking at her hair. I'm gonna be noting the quantity, distribution, texture, if there are any patches of hair loss. I'll be assessing her scalp, making sure that the overall scalp doesn't seem too large or too small, which could indicate hydrocephalus or microcephaly. I want to make sure to feel for deformities when I get to palpation. And again, I can assess if there's any lesions, scaliness, any nits present. I'm going to also assess her face, looking for symmetry, looking for any deformities, any lumps, any discoloration, any involuntary movements or tics. And then I will assess skin, once again, looking for discoloration, lesions, and then if she did have facial hair, I could look for distribution of facial hair. So I'll go ahead and I will start my inspection and palpation. I'll start again at the hair. So I'll be parting the hair, looking at the scalp, assessing distribution. Once again, the patient's hair is thick, it's brown, there's no patterns of loss. I don't see any lesions on the scalp. Look down underneath as well. And then just looking at her head, it looks to be normocephalic. Her skull shape seems pretty normal without being obviously hydrocephalic. And then her face, her facial expression is calm. She looks content. Her face is symmetric. I don't see any deformities, any lesions. I don't see any involuntary movements. All of the contours look within normal limits. And then as far as skin, looking for any discoloration, any lesions again. Good. So I'm gonna palpate your skull, checking for any deformities, checking for symmetry, any tenderness. Good. So everything feels symmetric, no tenderness, no deformities, no lumps. So next I'll move on to the temporomandibular joint. I'm looking for any swelling, any redness, if there's any obvious muscle hypertrophy, looking at both sides to compare. And then I'll go ahead and palpate. Any tenderness, go ahead and open your mouth and close and kind of grit your teeth together. I don't feel any clicking or snapping. Was there any pain with that movement?
No.
So no pain, no redness. So that area seems to be good. Next I'll move on to the neck. First I'm going to inspect. I'm again looking for symmetry. I'm looking for any scars or masses, tracheal deviation, looking for the thyroid, and then we'll assess range of motion. So looking at her neck, everything looks symmetric. I'm not noticing any tracheal deviation on inspection. Can you tilt your head back slightly? I'm looking for thyroid. I'm not seeing any swollen glands. Can you go ahead and swallow? Sorry, I know it's hard. I'm not seeing any abnormal masses or swelling. So next I'm going to go ahead and test range of motion. So can you go ahead and flex your neck down and then all the way back? Turn your head side to side. And then tilt your head, put your ear to your shoulder. Any tenderness or pain with that? Good. So range of motion for neck seems intact. Next I'll go ahead and palpate. In the neck I'm going to palpate lymph nodes. I'm going to palpate for tracheal deviation, thyroid, and any cervical spine and muscle tenderness. So we'll start with lymph nodes. So I'll use the pads of my fingers for this. If I did find a swollen or tender lymph node, I would note the location, shape, size, if it's just a singular lymph node or a group, the texture, if it's hard or if it's soft, if it's mobile or not, and then I would record those. So we'll start pre-auricular, post-auricular, occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical, and then the deep ones, which I don't think we can palpate, and then supraclavicular. Any tenderness with that palpation? And I wasn't feeling any enlarged lymph nodes. Otherwise, I would record them as I stated before. Next, we'll assess for tracheal deviation. So I'm going to palpate one side of your trachea and then the other to note if there's a difference. Trachea is midline, it is not deviated. And then for thyroid palpation, I'm going to come behind. I'm going to have you tilt your neck back slightly and palpate for any abnormal nodules, any swelling, the texture. Go ahead and swallow. Good. I'm not palpating anything abnormal with that. And I'll stay back here. I'll assess tenderness. Would you mind just turning slightly that way? And then I can, just so it's on the camera. So I'll palpate back here along your cervical spine. Any tenderness with that? And then along the muscles. Any tenderness throughout the muscles?
No.
Good. And then the last thing, if I did note any abnormalities with the thyroid, any nodules or swelling or asymmetry, I could then palpate to listen for a bruit. And that is the head and neck exam. All right, next we'll move to your ears, nose, and throat. So first, I'm going to inspect your ears. I'm going to be looking at the auricles. I'll look at the front and the back, looking for any lumps, any masses, any lesions, any sort of deformities. Look at your other ear. All right, and then while I'm over here, I can also palpate. So I'm going to, again, palpate the auricle, I'll palpate the tragus, and then I'll palpate the mastoid bone. I'm looking for any tenderness, any nodules, any sort of masses, any swelling, any tenderness.
No.
Any tenderness there?
Mm-mm.
Any tenderness over here?
No.
And I'm not feeling any abnormal masses. So next what I'll do is I will assess hearing using the whisper test. So I'm gonna stand a couple feet behind. I'll have you occlude your opposite ear. You can either plug it or kind of rub your tragus in circles, either way. And I'm gonna whisper a word and you can repeat it to me.
Coffee. Table.
Good. And then I'll go to the other side.
Backpack. Pillow.
Good. So hearing acuity is intact. What I'll do next is I will go ahead and do the otoscopic exam. So what I'm going to be looking for is within the ear canal, I'll be looking for any foreign bodies, any lumps, erythema, any drainage, just making sure that the ear canal is patent, noting if there's excessive cerumen. And then when I'm looking in at the tympanic membrane, I'm going to note the color. I'm going to note if the tympanic membrane is bulging or swollen, if the malleus is in the correct place coming down from the superior aspect. I'm going to note the cone of light should be at 7 o'clock on the left, 5 o'clock on the right, and just looking for any perforations as well. All right. I'm going to make sure to stabilize the otoscope on her face and pull the ear up and out. No bleeding, no foreign bodies or masses. The tympanic membrane was pearly gray, it wasn't swollen or bulging or red. And then we'll go ahead and do the same thing on this side. Good. And again, everything looking within normal limits on this side. No swelling of the tympanic membrane, pearly gray, nice and shiny. And then if we needed to, we could also perform special tests. If we wanted to look at the mobility of the tympanic membrane, we could use a pneumatic otoscope. And if we wanted to assess conductive versus sensory neural hearing loss, we could use the tuning fork to perform the Weber and Rinne tests. The Weber test would be getting the tuning fork vibrating, placing it up on the top of her head and noting if sound is heard better in one ear or the other, or not in either or both the same. And for the Rinne test, we would get the tuning fork, place it on the mastoid. Once the sound has gone away, moving it to the air to notice if air conduction is greater than bone conduction or vice versa. So finishing up the ears, we next would move to the nose. So first I'll inspect, I'll look for any deformities, I'll look for symmetry, again, any lesions that might be present. So her nose looks symmetric, there's no obvious deformities, no skin lesions. Next I'll palpate the bone and the cartilage on both sides, making sure there's no tenderness, lumps. Yeah. So let me know if you have any tenderness. Any tenderness with that? We'll assess the patency of her nares, so go ahead and breathe. Good. And other side. Good. So both nares are patent. Next I'll go ahead and I'll assess sinuses for pressure. So I'm going to be feeling underneath your cheeks here, pushing upwards. Is there any tenderness?
No.
And then frontal sinuses. Any tenderness?
No.
If needed, we could also do a special test using the pen light to transilluminate the sinuses. For the frontal sinuses, we could shine the light up under the eyebrow. For the maxillary sinuses, we could shine the light down towards the roof of the mouth, noting any illumination. So next we'll go ahead and I will look inside the nose. And looking inside the nose, I'm going to be looking at the mucosa. I'm going to note the color, if there's any redness or bleeding. I could also assess if there's any paleness, any swelling, any abnormal drainage, ulcers, polyps, that sort of thing. I'll also then look at the septum to make sure there's no septal perforations, swelling, or inflammation. Good. No redness, no perforation, no swelling. Good. No abnormal drainage, no nodules, that sort of thing. So next I will move on to the mouth. First, I'm going to inspect once again. I'll inspect the lips for any lesions, cracking, color, texture, any scaliness. Then I'll look inside the mouth at the oral mucosa, noting its color, if there are any areas of pigmentation, hypo or hyperpigmentation, any white patches, ulcers, bleeding. For that, I'll use the tongue blade and a light. While I'm in there as well, I'll look at gums and teeth, noting color, swelling, any ulceration or receding gums. For teeth, looking for any obvious dental caries, any abnormal position teeth or missing teeth. We can also look at the tongue, noting its texture, its color, if there's any masses or induration. Looking at the hard and soft palate, again for color, swelling, making sure the uvula is midline, looking back at the pharynx, making sure the tonsils are symmetric, that they're not swollen, that there's no exudate. So I will go ahead and I'm going to put gloves on because after I inspect, I'm also going to palpate. So what I'm noticing from the outside, your lips are symmetric, there's no cracking, there's no scaliness, they're pink, they're not pale or cyanotic. Go ahead and look at your oral mucosa, so go ahead and open your mouth. Oral mucosa is pink, there are no lesions or swelling, there's no discoloration or white patches. Go ahead and look at your gums and teeth. And can you open your mouth? I don't see any obvious dental cavities. I don't see any loose teeth or abnormally shaped teeth or missing teeth. All right, go ahead and open again. I'm gonna look at your gums. So just kind of go like this. So looking for any receding gums. Color is pink. Everything is moist. Her mouth and gums are not dry. The oral mucosa is not dry. Nothing is swollen or ulcerated. Next, I'll look at the hard and soft palate. So go ahead and open. Color again is pink. With the hard palate and soft palate, we could note if there was a cleft palate before, if anything has been repaired. No masses or lesions in there. I'll go ahead and note the color of the tongue. So stick out your tongue and kind of move it side to side and up and down. Good. So we would expect to see the normal taste buds, the papillae on the tongue. There's no lesions. The tongue is symmetric. I'm going to go ahead and look back at your pharynx, so I'm going to use the tongue blade. The uvula is midline. And the tonsils are symmetric. They're equal. They're not swollen. I would say probably, I don't know, +2. But they're not swollen. There's no exudate. They're not, there's no erythema. And then I'll go ahead and palpate. So I'm going to palpate your tongue and underneath your tongue and your teeth. Just hold it. Looking at both sides. Palpate the floor of your mouth. Any tenderness. Sorry, you probably can't talk. And the sides of the tongue for any induration. And then teeth. No loose teeth. Alright. And that is the ear, nose, and throat exam. Alright, next we'll go ahead and move on to the eye exam. So first we'll assess your visual acuity. We'll use the Rosenbaum chart. And I'll have you go ahead and cover one of your eyes. Oh, first, do you wear glasses or contacts?
No.
Okay, perfect. I'll go ahead and have you read the smallest line possible.
428739.
All right. And go ahead and cover the other eye. You can acclimate a little bit.
428739.
Perfect. So that means you would have 20/20 vision, which is great. Next, we'll go ahead and do the visual field testing. So what I'm going to do is I will cover an eye, depending on whatever eye Jocelyn covers, and then we'll wiggle fingers to make sure that all of your visual fields are intact. So whatever eye you'd like to cover. So I'll go ahead, I'll close the opposite eye, and just let me know when you can see my fingers kind of wiggling in, okay?
There.
Good?
There.
Okay.
There.
Good. We'll do the same thing with the other side, so I will close this eye, you cover that eye. Go ahead and let me know when you see my fingers.
There.
Good.
There.
Good.
There.
Good. All right, I'm gonna also do coming across your face, so pick another eye to cover. And let me know when you see it kind of coming.
There.
Good, and cover the other. Let me know.
There.
Good. Perfect. So all fields of vision are intact. What I'll do next is, well, if we needed to, we could also test color vision. We would use color plates for that, where they have numbers set up in different color configurations, and we could test your color vision if needed. Next, I'll do a general inspection. So I'm going to be looking at eyelids, eyelashes, looking for any discoloration, any swelling, redness, lumps, like a sty, any sort of lesions, that sort of thing. I'm not seeing anything. I'm not seeing any discoloration. I'll look at the lacrimal apparatus, make sure there's no swelling, that there's no excessive tearing. Everything, there's no excessive tearing. Coloring looks nice and pink. I'll go ahead next and look at the conjunctiva and sclera. I'm going to note color. I'm going to note if there are any vascularities present, if there's any edema or discharge or nodules. So I'm going to pull down a little bit on your cheeks here to give me a better look. Go ahead and look up and down and side to side. Good. So conjunctiva is nice and pink. No nodules that I could see, no excessive drainage, redness, or swelling. Sclera is white, no vascularities present. And then next I'll look at the cornea and lenses. So to do this, I'll stand laterally to the patient so I can see that curvature of the front of the eye. For the cornea and lenses, I'm going to be looking for any opacities. didn't see any opacities. I will also use the same, what am I trying to say? The same angle of light to look at the iris, to look at the depth of the anterior chamber. And for this, we just want to assess if there's any shadows. This can kind of indicate glaucoma. Good. Not seeing any shadows. Good. And we could even estimate the diameter, the distance of that anterior chamber. Next, I'm going to go ahead and assess pupils. So I'll assess size, shape, reaction to light, both direct light and consensual light. So I'll shine the pen light in each eye 2 times. One time I'll be looking at the eye that I'm shining the light into. The next I'll be looking at the opposite, just to make sure there's that consensual reaction to light. And then at the end, I will bring the light closer and we'll test for accommodation. So go ahead, look behind my shoulder. I'm going to shine the light in your eyes. Keep looking ahead. Good. Good. So there is reaction to light, both direct and consensual. I'm going to have you look at the pen light and look into the distance and look back at the pen light. And there we're just looking for constriction to make sure that the pupils can accommodate, which they did. Next, I'll shine the light. Go ahead and you can look into the light, looking at the corneal light reflection. So for this, I want to make sure that the corneal light is reflecting just nasally to the midline in both of the eyes. Next, I'll go ahead and assess extraocular movements. So I want to make sure her eyes are moving fluidly together, making sure there's no nystagmus, lid lag, or conjugate gaze. So go ahead and just follow my hand. Good. And I'm going to bring my finger to your nose. Good. So extraocular movements are intact. If we needed, we could do a special test. We would cover and uncover the eye. Again, looking at that uncovered eye for any sort of lid lag, nystagmus. And then we could also, if we thought there might be a foreign body, another special test would be to avert the eyelid. We would use a tongue depressor to then flip Jocelyn's upper eyelid to give us a better view underneath if we thought there was a foreign body. So next, we'll do the ophthalmoscopic exam. So for this, I would normally darken the room for the purposes of the DYAD, so we have good lighting for the recording. I won't do that. But what I'll do first is I'll stand a couple, like 1.5 feet-ish away. I'll get the red reflex, and then once I find that, I'll move in closer. I'll be looking for the optic disc. With the optic disc, I want to note the color, the clarity of the outline, making sure that the margins are sharp. I'll note if there are, if there's papilledema, if both sides are symmetric, if there are any exudates present, and then the size of the physiologic cup. I will also assess the retina, looking at the AV junctions, making sure there's no AV nicking, which is when the arteries and veins kind of blend together at their junctions, making sure there's no masses, hematoma or hemorrhage, or exudates, and then looking at the fovea and the macula, again looking for any hemorrhages, exudates, or any other abnormal things that might be present. So go ahead and have you stare off at the wall back there. It's creamy, creamy colored. The margins are sharp. I didn't see any sort of abnormal papilledema or any exudates. Looking at the retina, the AV junctions were sharp. There was no nicking. There were no hemorrhages seen. And then the fovea and macula were the same. No hemorrhages or like cotton wool spots or anything. So we'll do the same thing on the opposite side. So first, I'll look for the red reflex. I'll go ahead and move in. All right, same thing on the opposite side. Looking at the optic disc, it has good coloration, nice and pink and creamy colored. Again, no papilledema, no hemorrhages or exudates. So everything seems to be normal, and that's the eye exam. All right, and then finally, the mental status portion of the exam. Most of this would be conducted throughout my interaction with Jocelyn in the appointment, making sure that thoughts and expressions are coherent with the situation, just noting general appearance and speech throughout our interactions. But for the purposes of the dyad, we'll go through most of the examination. So first, I would just assess appearance and behavior. So Jocelyn is alert and oriented. Her level of consciousness is alert and oriented. She's not comatose or lethargic. Her posture is upright. She moved fluidly onto and off of the exam table. It didn't look like there were any difficulties with her movement. I would note her dress and grooming. So she is dressed appropriately for the weather. She looks well groomed, looks like she practices good hygiene. I would also note her facial expression. So throughout the exam, she's been calm, cooperative. She doesn't seem to be overly anxious or depressed or euphoric even on the other end. So just noting that through facial expression. I would also note her manner and relationships to people and things in the room. So is she reacting appropriately to any of the situations that we discuss, making sure she's not interacting with people or things that are not present in the room. So following just general appearance and behavior, I would also note speech. I would make sure that the quantity, rate, and volume of the speech are what we would consider within normal limits. So making sure it's not rambling, just constant speech or no speech at all. Making sure that the rate is not too fast or very slowed down. Making sure that volume is not at a yell or a whisper. And then also just making sure that the words are fluent and articulated. So that she's not taking big pauses in between words, that she's able to clearly enunciate what she's trying to say. If needed, we could assess for aphasia. There are different ways to assess for that. I could give a 2-step command to see if she could, step off the table and pick something up off the ground. I could assess reading. She could read a passage for me or write a couple sentences. We could go through naming different items to make sure that piece of cognition is intact. Or I could say a phrase and have her repeat it. And all of those could be used to test for aphasia. Next, we would evaluate, not really test because you're evaluating it through the whole thing, evaluate mood and affect. So noting if she seems angry, indifferent or apathetic, if she seems, like I said before, kind of euphoric or really flat. So her affect has seemed content, and euthymic is the word that I found in the book. Just been very normal throughout the interaction. Next, I would evaluate throughout her thoughts and perceptions. So making sure that her thought process is coherent, that it's organized, that it's relevant and logical, that the content of her thoughts is not full of anxieties or compulsions or obsessions, that her perception seems intact. She's not seeming to have any sort of hallucinations or any delusions. And then just kind of evaluating insight and judgment, making sure that the words that she's speaking and her behavior throughout is based in reality. Finally, we would come to the cognitive functions. So we would assess basic cognitive function and higher cognitive function. So I'll go through these tests. First, I'll start out. So Jocelyn, I'm going to give you 3 words, and then I'm going to ask you to repeat them a little bit later. So the words are apple, table, and penny. So we'll come back to those, okay?
Yep.
All right, so I'm going to just assess basic cognitive function. So can you tell me your name?
Jocelyn Leonard,
And can you tell me where you're at?
Rockford,
And can you tell me what day it is?
Friday.
Good. So patient is oriented to person, place, and time. In addition to orientation, we could assess attention. So for attention, I'm going to do 3 different tests. First, I'll do digit span. So the digit span can be done usually starting with 2 digits, have her repeat them back to me, and you can work up to 3, 4, 5, and just see if the patient can repeat them back. So we'll just do 3 digits, and I'll have you repeat those back to me. 10, 35, 47.
10, 35, 47.
Good. And then we could do those backwards as well, if needed. If needed. So next we could do serial 7s. So this is counting backwards from 100 by 7. So just do a couple to the best of your ability.
So 93, 86, 79.
Good. That's good enough
32
for now. But we could continue to work backwards doing serial 7s to assess attention. And then if you could spell the word world backwards for me, please.
DLORW. No. WRLD.
Try again.
DLROW.
Good job. It's harder than it seems.
Oh,
So those could all be used to assess attention. And then next we'll move into memory. So she was able to tell me at the beginning of the visit her date of birth. So that would indicate her remote memory is intact. Next, I'm gonna have you let me know what the weather's like today.
Chance of storms.
Chance of storms. So that correct answer indicates that her current recent memory is intact. And then could you repeat the 3 words that I gave you a couple minutes ago?
Apple, table, penny.
Good. So new learning is intact. Next, we can assess higher cognitive functions. So I would assess information and vocabulary. One of the examples given was to name 5 large cities in the U.S.
Miami, Chicago, Dallas, Los Angeles, and New Jersey. That's pretty big, right?
Yeah.
New York and New York.
Yeah. So information is intact. We can assess calculating ability, so I'll give you a couple addition and multiplication problems. Can you tell me what 10 plus 2 is?
12,
And 8 plus 3?
11,
And then for multiplication, can you tell me 5 times 6?
30.
Good, so calculating ability is intact. Next, I would assess abstract thinking. We can have a patient kind of describe a proverb back to us or give sort of comparisons. So if I said a stitch in time saves 9, what would that mean to you?
I don't know.
Okay.
A stitch in time saves 9. Yeah, I don't know.
Or I could try another proverb. Or we could do a grouping of similar, I could give you 4 words and you tell me which ones are similar.
Okay.
So lion, tree, cheetah, apple.
Lion and cheetah.
Yeah, so those are the similar ones, so abstract thinking would be intact. And then finally, I could test constructional ability. For this, I'll have you draw a clock. Let me grab a pen really quick. Alright, can you go ahead and draw the face of a clock for me? Perfect. So constructional ability is intact. So that is the mental exam.